questions. Some of you guys missed it when I was in Costa Mesa. So I wanted to give you guys the opportunity to ask right now. My eye was a little irritated because I got like some like carpet hair in my eye. So yeah, we're gonna be asking, or you guys gonna be asking the professionals exactly what kind of threads, what kind of fillers to get. Any of your questions that you have, and you guys ask me, you guys have the opportunity to do it right now. I know it's super early, and most of my crowd comes in around 6 or 7. But if you guys really wanted to ask any questions, I did post it so you guys can come and see, all your questions today. So this is your opportunity to ask any of your filler questions, any of your thread questions, butt injections, anything that I got. Today's your opportunity. She's gonna be coming, right now. And even if you guys don't come on right now and you guys see this later, we will, I will just ask a lot of the random questions that you guys have asked me so she can answer them, and make sure that you guys have all the information you need before setting up any consultations, or before getting any procedures done. Because we want everything to be safe. All the stuff that I do, I make sure that I'm safe in doing that, and that I'm very informed. So I want you guys to do the same. I don't have my tripod. I don't know how I forgot that, but yeah, so we're gonna be just sitting here just a little while, waiting for you guys to come on. And yeah, so let me just sit this here. Hopefully it'll work. I don't know. No, it's not gonna work. So yeah. I wish I had something to sit this on, but I can't because I didn't bring my tripod. But yeah, I could kind of go around this place to let you guys see the place. Generally, when you guys come here at Skin Perfect, this is the area that you're going to be at. And everything is pretty clean. I'm not getting any procedures today, but everything is very, very clean. And they have products as well for preventative aging, all that kind of stuff. So and then it talks about, the threads, and shows you some before and afters. So this is the place. It's very clean. They wipe everything down. And yeah, so I know that you guys will see this a little later. I know it's hecka early. I got my hair done, and I have a video coming out about that. So yeah, for that 2 people that's on right now, if you guys are into procedures and you guys want to ask questions to the professionals today is the day, because Yvette is going to be answering all y'all questions in just a moment. So I'm just waiting for her to come in here, and then you guys can ask whatever questions. Who's on right now? Who's the 3 people that's on right now? So I don't know if I should stop this live and redo it until she comes back. I don't know. But until she comes in here, you guys can ask me whatever. We can chit chat. Get your questions ready. Hi, how are you doing?
Nice
Good.
To see you.
I was already on live.
Okay.
So I forgot my tripod, so I just have to hold it like this. Yeah.
Okay.
So
do you want me to ask somebody to come in here? To like hold it for
Is
you?
it gonna be too much?
No, I can ask
somebody. Are you sure?
Yeah, hold on.
I don't want them to be like, oh.
It's okay. Hold on.
Hi, Daisy from Brazil. Oh my gosh. Brazil is in the house. That's so crazy. Like, I love to see my followers from different places. And that is just so crazy, from Brazil. So, Daisy, today we're going to be answering all of the procedure questions. If you have any, if you guys don't come on until a little later, I'm going to ask all the questions for her, or for you guys, and just ask random questions. Hey, Aaliyah from Jamaica, right? How are you doing? I love to see it. I love to see Brazil, Jamaica. Oh my gosh, that's great. So I've been on for 5 minutes. So we're gonna have somebody come and hold the camera for us because we don't. I can't hold the camera and do all this. Well, I can. You guys see me get my lip fillers done, and I was holding the camera the whole time. But we have 2 people into the frame, and we got to make sure that both of us is in frame and all that kind of stuff. So yeah, for the 3 people that's on, if you guys have any filler, thread, injection questions, she's about to answer all of those right now. So get all your questions together. She's about to go get somebody to hold this camera for us. They just have to hold it kind of still. Who else is on? Let me know who else is on. Oh, thank you, Daisy. I watched your last 2 videos. Hi, Amber. I saw your video with the stretch marks treatment. Have you seen any improvement? Yes, I have seen improvement, Michelle.
She needs a little bit of help with the.
Don't worry.
Is she sure? I can hold it. Hi, Daisy. This is great. Okay. Sorry. Are you gonna be okay?
Yeah.
Okay.
You're fine.
So these are some of the people that's coming on. If you guys have any questions about the fillers, you can ask her right now. Is it good for you?
Absolutely. Yes.
Okay.
Yes.
So I'm gonna ask some questions. My following base usually don't come on until around 6 or 7, so they're gonna see this all the way after.
Okay.
So the few people that's on here might ask, but I'm gonna ask some of the questions that they've been asking me.
Absolutely.
Okay, so I got a question that said that the butt fillers are dangerous and that it could have some like thing that travels to your lungs and can kill you. And
so basically, anytime you inject anything into a blood vessel or an artery, of course it's dangerous. But that can happen on your face, that can happen on any body part. So it's important that whenever you get injections that the provider aspirates, which means bring back the plunger on the needle and minimize the risk of actually getting the product into a vessel.
Okay.
So it's not exclusive to just the buttocks. I mean, you just want to make sure that you don't get the product into a vessel.
Right.
We try to avoid using HA fillers, which is basically hyaluronic acid. In the buttocks in large quantities. We usually do biostimulators. What we're trying to do is stimulate the body to create its own collagen and volume. So we do Sculptra and hyperdiluted radius a lot more frequently than the HAs, which are a little more robust and more likely to end up, unfortunately, going into a vessel.
Right. So hi, Tracy, because she said hi. But so basically, is it because she was saying, I guess she's a tech, I don't know what she is, but she was just saying how dangerous it is. So what is the chances of something like that happening? Is it a high risk? Is it
if you go to an inexperienced injector or an injector who's moving too rapidly and really not paying attention to what they're doing?
Right.
Yes.
Okay, so you guys got that answer. I know a lot of you guys had concerns after that subscriber put that information down there. So this is why I go to people that are certified and not just somebody just injected me. Another question is, does it dissolve?
So the stuff that I used on you, and like again, those stuff we typically tend to use here are biostimulators, which means that they're creating collagen and elastin in the area that we inject. So that's not going to dissolve. If we're doing hyaluronic acid fillers, the body will eventually break down that product.
Okay. They said, did I get any side effects from the threads? I didn't get any side effects from the threads at all. Are there any side effects to threads at all?
I mean, as far as side effects, you get what I call thread aches. It's a little achy, obviously, because it's a little traumatizing to the tissue initially. But a little Tylenol or ibuprofen usually minimizes that.
I just had a little bit of headaches, that's it. And then I took Tylenol and it was gone. I didn't have any real issues with it. It was just like swollen, that's it. Pretty much.
A little bruising, a little swelling, all expected.
Yeah.
If the person doesn't take care of it initially in the beginning, you can end up getting a little bit of migration of the thread, but it's nothing that can't be fixed.
Right. And my bruising, I didn't have bruising. And that's another thing. Everybody's kind of different. because I know a girl said she got the thread, the nose thread, and she has a scar up her nose. And I said, well, you remember the little dot that was there? It went away in like 6 days. So I think everybody's different.
There shouldn't be any scarring though, unless
like that she had.
Right, perhaps the placement of the thread was too superficial.
She said that she has a big scar. Can the butt fillers eliminate the cellulite?
So yes, sometimes we use it for volume. So when someone has what we call hip dips, so the sides of the buttocks kind of indent a little bit, we put volume there just to make it more round. But we can also do it specifically in any area of imperfection. So if the person has a lot of cellulite or little divots that they want to minimize, we can use it superficially and take care of those.
Okay. And so is there anything to be kind of worried about when you go to an injector, if like to identify something is not right?
Well, you want to ask for their credentials and make sure that they've done due diligence and they continue to get continued education. So just because they've been a doctor or a mid-level provider for 20 years, you want to find out how long they've been in this industry specifically,
right,
and how frequently they continue getting education, because we all need to continue to learn.
Yeah.
Because unfortunately, there are side effects that are potentials. Just like when you go in for plastic surgery, you can have a stellar plastic surgeon, but they still have you sign consents of the scary stuff that can happen. So you just want to make sure that your provider also knows how to handle complications.
Right. So you guys have any questions? I've been asking some of the questions for them because it was a lot of them on there. A lot of people seem very interested in butt injections, but they were scared because you know how the basement butt fillers. What is the difference between the basement butt fillers and?
Unfortunately, we do get people coming in here who've had stuff done at somebody's house, in someone's garage, at a neighbor's house, and sometimes they come in here because they want us to break down the product. So we inject things to break down what we think is hyaluronic acid, which is what we use in our industry, and it doesn't break down. So I don't know what they're truly injecting into them, because it may not actually be what they're selling them.
Okay.
So you don't know, you never know if it's something that should be even injected into your body. It's just too dangerous to tell.
Yeah, so don't do the basement fillers. You guys want to be safe and go to somebody more certified. And they said, what is the 2 fillers that was injected again?
So radius.
So it was radius.
Hyperdiluted radius.
So using sculpture to the face fillers versus some other fillers used on the face. Tracy said, what is like what is the difference between using sculpture on the face and using other fillers? Like, what is the pros and cons to it?
So again, the biostimulators like Sculptra and hyperdiluted radius are almost like a little fertilizer. We're going to inject it into the face or the body where we want to stimulate that area to create collagen on the patient. Whereas the HA fillers, which are like just volume creating, are instant, and that is made out of a hyaluronic acid.
Okay.
Hyaluronic acid is something that's already present in our bodies. We have it predominantly, for example, in our joints, that helps lubricate the area and keep it mobile. When we inject those HA fillers, they attract water to themselves, which is what creates the volume. And in time, the body will break those down.
She said, she basically said once you start getting fillers, you have to keep getting them done.
No, you can stop and discontinue at any time. You just pick up where you left off. It doesn't make the wrinkle or the indent any worse than it was before.
I'm sorry, you getting lost. Sorry. Are you okay? I don't want to.
I'm fine.
Are you sure?
Yeah. Well, I'm not moving. I don't know. I don't know if it goes up.
But yeah, basically she's saying that she heard that once you get fillers that you have to continue to get them.
No, that's a myth.
So yeah, that's a myth, you guys. I got fillers for the first time under my eyes, I think 3 years ago, and I didn't get them for another 2.5 years. So I didn't have to continue to keep getting them done, and my eyes didn't look as bad as they did when I first came.
Correct.
So no, you don't have to keep getting them. So if you guys have any other questions, I'm trying to think of the other questions that they asked me about. They were worried about the popping when I told them that one of them kind of popped a little bit. And so it didn't make, the thing is, it's still firm. Like, it's still, like, you know what I'm saying? It's still firm. At first, it was really, really loose. And now I can't, like, move my skin like that anymore.
Right, because
So-
it has little barbs, and
Mhm.
so when we put them in there, they attach to the tissue. So maybe you'll hear one kind of release, but there's so many others, making sure that there isn't a shift.
Okay. And they also asked about how many nose threads in. A lady said, you look like you put 6 in my nose, but you kept saying 3. What filler did you get under the eyes? With the thread lift, does the thread dissolve over time? The filler I got under my eyes the first time, wasn't it Restylane with Trish?
Restylane lift.
Restylane lift with Trish, and then I got it again with Trish as well. And then the second question was, does the threads dissolve?
So yes, they're meant to dissolve. They're dissolvable sutures. Just like when you have any surgical intervention. So if you have surgery of any kind, they'll suture you up. What they're trying to do is keep the tissue there long enough for your body to heal and stay there even after the suture dissolves. It's the same concept here. We're lifting the tissue with dissolvable sutures. We want the tissue to stay there long enough to finally adhere there, and then the suture itself dissolves so the thread goes away.
And she said, did I get my nose touched up after? And how many like times do I need to do it, or do I gotta continue to do it? It's not a permanent procedure. You have to continue to get it done because it does dissolve. Right?
Correct. When you're doing something for lifting, for example, when we do like foxy eye or cheek lifts, that's more likely to need to be done repetitively, maybe in 6 months, maybe in a year, just depending on how extreme the patient wants it to go, just because of laxity and gravity and the aging process. Areas without movement, like the nose, you need to do that a little less frequently because there's no movement, and most people, once you get them to where they're super happy, don't come back for a while.
Right. That, yeah, pretty much. And then she said that she keloids easy. Is it okay to get injections on the face when she keloids?
Yes, it's more dangerous if you're prone to keloids to do lasers than it is injections. Injections tend to be under the tissue, so we really don't run across any issues with keloids for that.
Okay. Another lady asked me about that at the gym too. She seen some of my videos, and she said that she keloids and she didn't know if she could get microblading or anything on her face.
Microblading, the person just has to be really knowledgeable because you don't want to cut, because if her body tends to keloid after an injury, if they cause any injury with microblading, they can potentially scar.
Have some issues, yeah. So is there any more questions, you guys? I'm trying to think of all the other questions that they told me. Did you answer the 6 threads?
The threads. Okay,
Yes.
so it really just depends on how much projection the patient wants. Normally I put in 4 on everyone across the board, and then I hand the actual mirror to the patient.
Right.
And if the patient says, I like it, but I wish you'd give me a little more, then I'll put in 2, perhaps 4 more. So average is 4 to 8 threads in a visit.
Because the lady said it looks like she kept cutting them and putting them in, and I'm like, I don't know, I didn't see.
No,
I didn't see it.
we don't cut them. We actually just put them in and then wiggle out the cannula.
Another thing somebody asked, was there screws involved? I didn't see any screws, but
So it basically may look or seem like I was using a screw, but the way that they work, it's a cannula, and inside the cannula is our thread. So when we put in the cannula, we release the cannula and leave the thread behind. And I know this might sound a little crude, but it's almost like a tampon. So I push it in with the plastic, and then I bring out the plastic, and the tampon stays behind. So the string is still in there, but I've taken out the cannula, which maybe if someone's watching the video looks like a screw.
Right. Thank you, Sheila. She said I look beautiful.
Always,
That's because of her.
always.
She always keeps me beautiful.
She always.
So I'm hoping that if you guys have any questions, that you guys post them a little quicker, because we have somebody holding the camera. But another thing they also asked was about somebody asked about the jaw injections, because they remember when I was talking to you in Costa Mesa, and I said something about the jaw injections. They wanted to know, also the jaw injections, what is the procedure with that, and then the thread with the jaw injections? Or
So
whatever.
the difference between a jaw injection and threads, maybe sometimes we'll do both. When we do injections into the jaw, most of the time it's for structure. The person feels like they don't have a sufficient angle or they need a more prominent chin. Then we do fillers in order to mimic the look of the bone that normally goes there. When we do threads, it's more because the person feels like they're jowly because they have extra skin. So we'll bring back the tissue, and it really makes the line a little more visible and the laxity is a little less visible.
So does it get rid of the double chin? Is that what it
It minimizes it. If
Okay.
it's truly just skin. If the person has pinchable fat, that's not going to go away because all
Right.
it's doing is repositioning the skin. If it's actual fat, we have to destroy the fat with either a radio frequency or some other form of treatment.
And you know, the guy that did my IV, he was saying stuff about injections in the chin. Do you guys have that here yet? Because people were asking about that.
Well, we have injections as far as Kybella, I mean,
Okay.
to destroy the fat.
Yeah. So it is that brow bulge, that kind of thing.
Yes.
Does it spot reduce?
Yes.
Okay. So you guys, that's what that was. Because he kind of, I guess they got excited when he said, "Oh, I pierced something in my."
Oh,
Yeah.
you're talking about Ahmed. We did radio frequency, which is what I just mentioned. When we go after fat, we use radio frequency. It looks like you're having lipo because it's also a long cannula, but what it's doing is using heat to destroy the fat.
Okay.
And that's what we did for Ahmed.
Okay. Yeah, because they were asking me like, "What is that? What is that?" And I was like, "Just wait until he gets it, together," because he said it was tested first.
So we were testing it on him because it's not officially FDA cleared. The machine itself is FDA cleared and we use it all the time, but the tip that we used on him was different.
Okay. So yeah, anything you guys really want to know, all you guys have to do is call. If you guys have anything because I can't answer all the questions. I originally came as just a customer before I started being partners with them. So I was a customer first. So I don't know a lot of the spa questions and how to answer it. So it's best that you either contact Yvette on her Instagram. Is that okay?
Yeah, of course, absolutely.
Or you can call. I put the number at the bottom for you guys to actually call, because sometimes it takes me a minute to get to your questions and make sure I have the right answer for you guys, because I don't want to be making up stuff. Is there any other questions that you guys have? It takes a minute. It's a little lag. But another thing they were asking about is cool sculpting. You guys
We do offer that, absolutely. We have a body department that does cool sculpting. We call it our gym membership. And it's pretty fantastic because you can be put on machines that actually help stimulate muscle growth, other machines that will destroy fat with heat, and then things like cool sculpting, which will break down the fat cells using extreme cold in order to do that. To debulk anything that's pinchable will respond well to cool sculpting.
So with a person at the gym as well, she's my new workout buddy. She asked me, because she watches my videos, but she asked me, once you do cool sculpting, can't the fat go somewhere else? Thank you for this video. You look great. Thank you, Tracy.
Well, it's similar to liposuction. So say that they were to liposuction a majority of the fat cells in the area that you dislike, but then you go and continue eating poorly and you gain another 40 pounds. So that fat has to go somewhere. So there's a good chance that other areas will be a little bulkier than it was before.
Okay. Because she was worried about it traveling somewhere else.
It doesn't travel. If the person maintains their weight, then it shouldn't be an issue.
Okay. It says, does the cupping method actually, they didn't do cupping method here. Does it actually work? I didn't do enough sessions to know if the cupping method actually worked, because that's before I was partners with them. I had got the cupping, butt cupping. I didn't see a lot of results from the first session, so I'm pretty sure you have to do more than one session though. And then it says fillers versus threads. Which one would you recommend?
They do different things.
Okay.
I love threads to lift the tissue, because if you're trying to just lift by putting filler, people start to look super round and a little deformed. So sometimes you have to do lifting and then do the filler. So it's
Right.
not, they're not exclusive.
Okay. Yeah, so I like both.
Yes.
I like both of
Yeah.
them. And another thing is they said because I kept on saying that if I got the nose thing again, I would get the nose fillers in the threads. Because you did mention to me like what it was gonna do, like if I wanted to have a more of a projection to get the fillers, and if I wanted more narrowness to get the threads, right?
Yes.
So that's why I said get both. My nose looked great, like you know what I'm saying. So the next time I'll probably get a filler in it too, because I think that it would make the look even more better. That's just what I think. So get the extra $300 and do the both of them.
Yes, it's always a good idea to work with both the filler and the threads anywhere on the face. It's always going to look pretty together.
Yeah, but yeah, the butt cupping, a lot of people ask me about that. The butt cupping was generally just something I wanted to try to see if it would change. It didn't change instantly, and I think you need to do 8 sessions from what they said, and I only did 1, so I can't really say it was good or bad, you know, because I didn't do the full sessions. I just tried it. Anything else, you guys? I know you're tired, but
No, I'm
My
on.
hand's shaking.
I know.
Do you want me to hold it?
You're fine.
Give you a rest? But if you guys have anything else, I try to stay on for 30 minutes. So are you good for 4 more minutes?
Are
Okay.
you sure?
Are
Yeah.
you sure? Because I can hold it.
No, you're
We
fine.
can change our position.
Yeah, I can hold it.
No, you're fine.
So I'm gonna be on for about, actually it's gonna be 3 more minutes. So if you guys have any more questions, she's right here. Get your questions in as quick as possible. But while they're trying to think of what to ask, what else can you do you guys have here, offer here that you think that they might be interested in?
Well, radio frequency is by far my favorite right now for
Mhm.
people who don't have a lot of issues but want to just continue to have pretty skin as they age.
Mm-hmm.
The radio frequency is my favorite. It really does create better skin. So a lot of people just want volume and they want to lift, but then they neglect their skin.
Yeah.
And you can have a facelift, but your skin quality still can't be neglected. And I think a lot of people neglect their skin. So radio frequency, microneedling is great for most people. It helps with your pore size, your texture, your fine lines. It makes your skin a little tighter, which we can all use.
Yeah.
So that one I think gets overlooked a lot. So pay attention to your skin. Sunscreen. Make sure that you do exfoliate. That's pretty necessary and not sufficiently done.
Do you offer any treatments for hyperpigmentation for the face or acne scars or hair?
Yes.
no.
So we do offer a variety of options. I would have to see the patient. We love doing Cosmolon. Cosmolon is great for depigmenting. So if the person has hyperpigmentation, Cosmolon is a chemical peel. It's the hydroquinone and a retinol combination, and it does a phenomenal job with pigment. We have something called Spectra, which we also use for pigment. We have IPL. It just depends on the person's skin tone and what it is that we're trying to accomplish. As far as acne scarrings, we do a lot of microneedling with smooth threads to really kind of minimize the look of the divots and ulcerations that they get from the actual acne.
Okay. Thank you, Pretty. She says she's from South Africa and she loves me. I can only see them for a little bit before they disappear. I have to hurry up and try to read them.
It's okay.
And then it says, how long is recovery? For which one, PD Tucker? Is it from what you were talking about, or just threads, or injections? Which one? I'm not sure which one she's talking about. Can men get nose threading? I'm thinking about getting it.
Absolutely. Men can do anything we do here for the most part. We do have a lot of male patients, and I've done plenty of threads in it and also fillers and noses for men.
Okay, she said, PD Tucker said, for hyperpigmentation, what is the recovery?
So again, it depends on which of those modalities we use, because if you do the chemical peel, obviously you're going to have maybe about 4 days where you're peeling quite a bit. Whereas if I do the Spectra, you'll look like you just have a nice little pink hue, like you went for a little jog momentarily for just a few hours. But it just really depends. It varies person to person depending on what treatment we do. The downtime can vary vastly.
And then Pretty said that she has insane hip dips. Can the injections work for her hip dips?
It can. You just have to be realistic that you will probably need multiple treatments. We won't be able to get rid of the hip dips immediately because we're not using fat and transferring it there. So you have to wait until the body creates the collagen in that area, and then we repeat the process until the person's satisfied.
Okay. So you guys have any more questions? It's about 30 minutes. I know you guys, most of the bulk of the people come on later. Yeah, because I come on late.
We could reschedule next time.
Yeah. They come on around 6 or 7, but they still view it. And I'm like, dang, I wish I would have asked the question. So I'm trying to ask all the questions that you guys have already asked me, just in case you guys are not on. I'm trying to think of the last couple more questions. Do you guys want to get them in? Just let me know. Do you guys have teeth whitening treatments here?
We used to, but we don't anymore.
So you guys don't do any permanent makeup because they asked about that too.
And we used to do that too. Now we just do microblading and microscalp pigmentation.
Under eye dark circles. Poppy New said something about under eye dark circles. Do you guys have anything for that?
So it depends on what the darkness comes from. If it's for pigmentation itself, or if it's your blood vessels are superficial, or if it's because you're hollow. If you're hollow, we do filler. If it's actual pigmentation, we have to address the skin. And so we could use PRP under the skin. We'll do 3 treatments of PRP, and that really minimizes the look of that pigment under the eyes. Sometimes we'll also do some hydroquinone. It just depends. Again, it's really challenging for me to give you a broad statement that every time this is all we use. Most often it depends on what the pigment's coming from that we decide which one to use.
Right. And then another thing is you do virtuals now, right?
Absolutely, yes.
So they started to do virtuals for her because I know a lot of you guys are out of state. So if you guys need to do a virtual consultation, how do they go about that?
They still call the front desk and they'll just book an appointment on my schedule as if the patient was coming in person, and we just talk over the computer or your phone, whichever modality.
Do you guys do live? Is it like a cam?
Yeah, it's just on the computer.
Oh, okay.
I just press, they join a meeting. It's almost like Zoom.
Oh, okay. Okay, so you guys could do that as well, because I know a lot of you guys was concerned about trying to have a consultation. Is it free to do a consultation virtually?
Yes, they'll only take a credit card number. If you no-show, they will charge you a fee for no-showing. Okay. As long as you cancel, they will not charge you.
So you guys, if you guys want to do a virtual consultation with her, consultations, and it is free. So the front desk told me that.
It's free.
Yeah, the front desk told me that they just made a new thing for you. And I'm like, what?
Yes.
So you guys can get these consultations yourself, but I know a lot of you guys didn't know that. So for a lot of you guys that are out of state, you guys can do that. And did they change my code? Because I know she's like, so I'm like, I don't know for sure. But you guys can still use the code, but it's on your first procedure. It's not going to be on every single procedure. It's your first one. So I think they thought every time they use the code, it's just like 20% off every single procedure. It's your first procedure. Okay? So if there's not any more questions, we're going to go ahead and wrap it up. Is there anything you want to ask her? Her information will be linked below. And you guys can shoot her questions if she's not so busy.
Absolutely.
She's always so busy. I don't think they have anything else to say, so I'm going to go ahead and log off. I'm going to wait until 35 and then go ahead and go. But they've been pretty pleasant. They're pretty pleasant, you know. We don't have the trolls on tonight. Well, you guys, I'm going to go ahead and sign off. Any of the other videos that I did is all linked below. And make sure you hit that notification bell to get any other notifications. Okay, you guys? Bye.
Bye.